Before I go into more detail regarding Brugada syndrome, I think that it's important that I first discuss the heart. How does the heart work? The heart is supplied blood via the superior and inferior vena cavas, and it is delivered to the right atrium. The right atrium will then pump the blood through the tricupsid valve into the right ventricle. The right ventricle then pumps the blood through the pulmonary valve and into the pulmonary arteries. From there, the blood will enter the lungs, receive oxygen, and return to the heart through the pulmonary veins, and the blood will be delivered from the pulmonary veins into the left atrium. The left atrium will then pump the blood through the mitral valve into the left ventricle, and then the left ventricle will pump the blood through the aortic valve into the aorta. From there, the blood will be dispersed throughout the whole body. What powers the heart? The heart is powered by a special electrical system, actually, and it is called the cardiac conduction system, and I will discuss this more in the next slide. The cardiac conduction system consists of muscle cells found inside the heart's walls. These cells will send signals through the rest of the heart muscle, telling certain areas when to contract. I chose this picture because it shows how the system is connected, and this is outside of the heart, but we will see it within the heart in a later slide. How does this work? The sequence will begin with the sinoatrial node or SA node, and this causes the atrial muscles to contract. This node starts the whole entire process, and for that reason, a lot of people like to call it the anatomical pacemaker. From the SA node, the signal will go to the atrioventricular node or the AV node, through the bundle of His, down the branches, and into the Purkinje fibers, and that together causes the ventricles to contract. What would happen if this system became compromised? If this system became compromised, your heart would not be able to beat properly. This could cause a number of different conditions, and the most severe, cardiac death is a very high probability. The heart and electrical impulses. This slide will just give us a further understanding of the cardiac conduction system. On the image in the right, you can see the cardiac conduction system, and this is actually inside the heart. So you can see how it interacts inside the heart walls. Right here is the SA node. And you can see how the SA node sends the signal into both of the atria, how it would cause them to contract. It also sends the signal down to the AV node, which is right here. And the AV node sends its signal through the bundle of His, down the branches, and into the Purkinje fibers, which wrap around the ventricles, which would cause them to contract. The electrical impulses of the heart can also be monitored on electrocardiograms, which can be seen on the image of the left. This is a typical electrocardiogram that you would see. They consist of P waves, T waves, and the QRS complex. The P waves represent the depolarization of the atria. The QRS complex represent the depolarization of the ventricles and the repolarization of the atria, and the T wave represents the repolarization of the ventricles. What is Brugada syndrome? Brugada syndrome is a rare yet serious condition that affects the way electrical impulses pass through the heart. How does it progress? Well, Brugada syndrome begins at the cellular and tissue level with abnormalities which can cause a reduction in the right ventricular outflow tract or the RVOT conduction reserve. This may have direct effects on the NAV 1.5 and tissue effects, causing the RVOT inflammation, fibrosis, and gap junction abnormalities. These changes in RVOT structure and the NAV 1.5 current can disrupt normal depolarization. They can have secondary repolarization effects as well. This can also lead to impairments of the RVOT conduction reserve. If this occurs, this would mean that you would have defibrillation within your right ventricle, and that could cause you to not get blood pumped through your heart into your body properly. Who is at risk to develop Brugada syndrome? It's a rare disorder. It affects 5 out of 10,000 people worldwide. This disorder can really develop at any age, but the most common would be for people around the age of 40. Anyone is at risk for this disease, but typically those from Asian descent are at a higher risk, particularly Japanese and Southeast Asian ancestry. And men are about 10 times more likely to develop Brugada syndrome than women. There is thought to be something in this related to testosterone. Types of Brugada syndrome ECGs. I want to make it clear that Brugada syndrome, there is only one form of it, but it can present itself in 3 different types in ECGs. There is type 1 Brugada, which, as you can see, there's like a coved elevation segment for the ST wave. And then there is type 2 and type 3. And the only difference between type 2 and type 3 is that the elevation in type 3 is lower than the elevation in the type 2 wave. They are both saddleback shaped. The most common that you will find for Brugada syndrome is type 1 Brugada. And in order to be diagnosed with this disease, you either have to have type 1, or if you have type 2 or type 3 presenting, you would need additional tests done, of course monitored, while you are presented with medications. I want to talk a little more about what actually causes Brugada syndrome. Brugada syndrome is caused by a mutation in the SCN5A gene. This will cause a reduced expression in the NaV1.5 alpha subunit of sodium channels, which can cause the loss of the function within the sodium channels. And this will actually impair the action potential, which will cause other channel abnormalities along with the NaV 1.5 current. This will also cause depolarization, repolarization abnormalities within the RVOT, and this causes arrhythmias, defibrillation, all sorts of issues. And as you can see in the bottom left-hand corner of this image, sudden cardiac death is very common within this disease. One common issue with Brugada syndrome is that it is asymptomatic, which is a reason for why there are so many deaths related to it. But some symptoms that can present for Brugada syndrome would include fainting, palpitations, seizures, and having difficulty breathing. There are some treatments for patients with Brugada syndrome, one of them being taking their medications. One of the most common medications a patient will be given is quinidine, which helps to prevent a potentially very dangerous heart rhythm within these patients. Another one would be the implantation of a device to help control the heartbeat. The most common one of these being a pacemaker. As you can see in the image, this consists of a catheter, leads, and a generator, which they would link through the heart to help control the heartbeat. Unfortunately, there is no cure for Brugada syndrome. Let's review. Brugada syndrome is a rare disease that impacts the electrical system of the heart. It is caused by a mutation in the SCN5A gene. It is normally asymptomatic, but the common symptoms for Brugada syndrome would include fainting, palpitations, and seizures. There is no cure for Brugada syndrome, so this statement would be false. I have my friend Delaney here with me to ask a couple questions. Did you have any questions over the presentation?
Yeah, so I was just wondering about so the different types that you showed in the EKGs. On the first one, the slope was pretty high, so I was just wondering what that meant.
Like the type 1 versus the other types?
Yeah.
Okay, so type 1 is actually more advanced, so that's why you can see it more clearly on it, but I can't go back because of the recording process. But for the QRS complex in type 1, you can see that it's lower than the T waves normally are. And so the reason for that is because the depolarization, which is the outflow of the blood from the ventricles, the blood isn't fully getting out. So there's like a buildup, and that means there's more blood when the repolarization happens in the ventricle, causing the wave to be higher
Okay.
than the rest.
That makes sense.
Do you have anything else?
Yeah, so you said that one of the procedures was putting in a pacemaker. So I was just wondering how exactly that would help.
Help with
Brugadas.
Okay, so the pacemaker, it has catheters and leads which go into the heart. It has the generator, and the generator will send signals through the catheter that tell certain areas when to contract. It works as the conduction system, so they have it in spaces that tell the atria when to contract, the ventricles when to contract.
Okay. And then I did have one more question. I was just wondering that mutation that occurs to cause Brugadas. I was just wondering how exactly you get that. Is it genetic or is it something?
Yeah, so it is genetic. More likely than not, you'll pass it down to your kids if you have the syndrome. You can develop it, but that's less common. Normally it's genetic.
Okay, so how does that gene normally work if it's not mutated? What is it supposed to do?
So the gene it's responsible for making the sodium channels of your heart. So if you don't have them working properly, then it will cause Brugada syndrome, which impacts the endocrine system.
Okay, all right. That's everything I have.
Woohoo! Here are the links to all the images I had throughout my presentation. And these are all the links for my information. Thank you for listening.